Many people believe that if they could just find the right test, their gut problems would finally make sense. They assume that confusion means something has not yet been measured, that once the correct lab panel is done, the answer will be obvious and the solution will be clear. This belief is understandable, but in gut health, it often leads to frustration rather than clarity. As a doctor, I see this pattern constantly. Patients arrive with stacks of test results, highlighted values, and long lists of abnormalities. Yet they feel worse than ever. Gut tests are not useless, but they are frequently misunderstood, overinterpreted, and taken out of context. This is why they often confuse patients instead of helping them. To understand why, we first need to talk about what gut tests are actually measuring. Most gut tests are indirect. They do not measure symptoms. They do not measure nervous system regulation. They do not measure how safe your body feels. They measure fragments, markers, byproducts, or patterns that are assumed to represent something happening in the gut. This assumption is not always wrong, but it is incomplete. For example, stool tests analyze what leaves the body, not what is happening at the gut lining or within the nervous system. Breath tests measure gas production, not how the gut moves or how the brain interprets sensation. Blood tests measure immune responses, not the reason those responses exist. Each test captures a snapshot, not the system. The gut is dynamic. It changes from day to day, even hour to hour. Stress levels change, sleep quality changes, hormones fluctuate, meals differ. When we test a dynamic system once and treat the result as a fixed truth, we risk misunderstanding what is really going on. One of the most common problems with gut testing is lack of clinical context. A test result is not a diagnosis. It is a data point. Without understanding the patient's symptoms, history, nervous system state, lifestyle, and timeline, numbers alone are misleading. A mildly abnormal result in one person may be irrelevant. The same result in another person may be meaningful. The difference is context. Another issue is that many gut tests label normal variation as pathology. The gut microbiome varies widely between healthy individuals. There is no single ideal microbiome. When tests compare your results to an artificial optimal range, they can make normal diversity look like dysfunction. This creates unnecessary fear. Patients are often told they have multiple infections, overgrowths, or deficiencies based on test results alone. This language is powerful. It creates the impression that the gut is under attack. Fear increases. Vigilance increases. The nervous system becomes more reactive. Symptoms worsen. The test has not healed anything. It has changed perception. Another common problem is testing without a clear question. Good testing starts with a clinical question. What are we trying to understand? Are we evaluating motility, immune activation, malabsorption, inflammation? When tests are ordered broadly without a specific purpose, the results become overwhelming. More data does not equal more clarity. There is also the issue of false positives. Many markers used in gut testing are not specific. They can be elevated for many reasons. A positive result does not always mean a problem that needs fixing, but once a label is applied, it is hard to remove. Patients begin to identify with the diagnosis rather than the process. Another limitation of gut testing is that it often ignores regulation. Many gut symptoms are driven by nervous system dysregulation rather than structural damage or infection. No stool test can measure threat perception. No breath test can measure emotional load. No blood test can capture chronic hypervigilance. Yet, these factors strongly influence digestion. This is why some patients treat every abnormal result aggressively and still do not improve. They remove foods, add supplements, take antimicrobials, follow strict protocols. The gut environment becomes more stressed, not less. Symptoms persist or even worsen. The conclusion is often that the case is complex or resistant. In reality, the system has not been supported at the level it needs. Another reason gut tests confuse patients is that they often lack clear action thresholds. Many results fall into gray zones, not normal, not clearly abnormal. Patients are left wondering what to do. Should they treat it, ignore it, retest it? This uncertainty creates anxiety and erodes trust in the body. It is also important to understand that many gut findings are adaptive. For example, certain bacteria may increase because the gut environment favors them at that moment. This does not mean they are enemies. It means the system is shifted. Killing them without understanding why they grew can destabilize the ecosystem further. The same applies to inflammation markers. Mild inflammation can be protective. It can be part of healing or adaptation. Suppressing it without addressing the trigger can delay recovery. Tests do not tell us intent. They tell us presence. Another issue is timing. Testing during a flare versus during a calm period can produce very different results. Testing during high stress, illness, or sleep deprivation may reflect temporary states rather than chronic problems. Treating temporary states as permanent diagnoses creates confusion. Patients often ask, "Why did my test show this, but I don't feel that symptom?" Or, "Why do I have symptoms, but my test is normal?" Both scenarios are common. This is because symptoms in tests measure different aspects of the system. Symptoms are experiences. Tests are measurements. They do not always align. It is also worth addressing the commercial aspect of testing. Many tests are marketed directly to patients. They promise answers. They promise personalization. They promise clarity. But without professional interpretation and systems thinking, they often deliver complexity instead. This does not mean testing should be avoided. It means testing should be used carefully, selectively, and thoughtfully. The best tests are those that answer a specific clinical question and are interpreted within a broader framework. In gut health, the most important information often comes from the story. When did symptoms start? What was happening at that time? Was there stress, illness, antibiotics, travel, hormonal change, or sleep disruption? How do symptoms fluctuate? What makes them better or worse? This information cannot be replaced by any test. Understanding regulation is often more important than identifying a label. A gut that reacts to stress will produce different test results than a gut that feels safe. If we change regulation, the results often change on their own. Many patients feel relief when they stop chasing every abnormal number and start focusing on supporting the system. They begin to eat more consistently, sleep improves, fear decreases, digestion becomes more predictable. This happens even before any test result changes. The goal of testing should not be to prove that something is wrong. It should be to guide support. If a test increases fear, confusion, or rigidity without improving outcomes, it is not serving its purpose. Gut health is complex because humans are complex. Reducing that complexity to a single result is tempting but inaccurate. Healing requires integration, not obsession. In future videos, I will explain how to interpret gut symptoms without over-testing, when tests are actually useful, and how to approach gut healing without becoming trapped by data. If you want calm, doctor-led explanations that prioritize understanding over overwhelm, subscribe to this channel. Your body is not a collection of broken parts. It is a system responding to its environment. Thank you for watching.